My guest today is Professor Paul Salkovskis. Welcome, Paul. Would you like to tell the viewers who you are, what you do, introduce yourself?
Of course, right. Okay. I'm Professor of Clinical Psychology at the University of Oxford. I'm also the Director of the Oxford Centre for Psychological Therapies.
And Paul, you are an expert in many things, actually. We've heard you talk about obsessive compulsive disorder, but I get asked a lot of questions on health anxiety, and I have a lot of patients who have health anxiety in my day-to-day practice. Coming from the angle of cognitive behavior therapy, I think it will be very useful to talk about health anxiety today. So if we can start off with, how do patients present to you in your day-to-day practice?
Health is one of the most important things that in your life. So people get frightened that, for example, that they are ill or that they might be going to get ill. So health anxiety, broadly speaking, divides into two categories. There's people who have illness phobia, where they're afraid that they'll get something that they haven't got. And that's a relatively easy problem to treat. The more difficult one is where people believe they have an illness and think that the doctors haven't found it or they haven't identified it properly. So they're afraid they already have it. And that's the thing called disease conviction. And that's the most difficult thing, because of course, if they come to see you as a psychiatrist or me as a psychologist, then we're the wrong person because they have cancer or they have motor neuron disease or whatever. So how can we possibly help?
I often talk about distress because health anxiety comes with a lot of personal distress, right? Most often people have been to their GPs or even A&E or different consultants multiple times, have had endoscopies or different investigations, bloods or otherwise. Nothing has been found, and then the GP or someone has advised, why don't you go and see a psychiatrist, and they are so distressed. You very eloquently described the two types. Now, and you have also described some of the differences between them. In terms of presentation, how do you see the differences in presentation?
Oh, it's simply in terms of what they want. I mean, so someone who is saying, I'm anxious about my health, wants help with their anxiety. Someone who says, I have cancer, I don't know why I'm here. Well, they're looking for something slightly different. They're looking for you to rule out psychological factors, which of course is not generally what we're going to do with health anxiety.
No. And then from a psychological standpoint, how do you as a professional understand health anxiety? What do you think might be happening in terms of people's interpretation of their, aches, pains, twinges, those are the kind of things, lumps and bumps that they might misinterpret as something more sinister? How do you understand it from a psychological perspective?
Well, from a psychological perspective, what we see is people have general beliefs which make them more vulnerable to being anxious about their health. For example, people might believe that if they notice a change in their body, that must be a sign of an illness. So it's not just a sensation, but it's a symptom of an illness. So if I notice something in my body, it must be a sign of something wrong. They also think that they must rule out any kind of illness. Now, the interesting thing is you cannot rule out every possible cause of any particular symptom. And so people get trapped in a reassurance trap. So one of the characteristics of severe health anxiety is seeking excessive reassurance.
Yes.
You mentioned already that people often will get investigations and so on. But there's a bit of a trap there for the doctor, for the GP as well. So, because most patients with health anxiety believe the only way to really rule out an illness is to have an appropriate test. But the same people typically also believe that if their doctor sends them for tests, it's because they think there's something seriously wrong. And those two beliefs clash. So the seeking reassurance is part of the problem. Now, we talked in a previous podcast about OCD. And one of the characteristics of OCD is checking. Reassurance is actually checking, but it's a very special type of checking, because you're a doctor. And if I mention that I have a mark here on my hand, a blemish or whatever, I can mention it to you and ask if you think it's okay. But not only have I checked with you, but now I've transferred some of the responsibility to you. So now you've got some responsibility for this. So the reassurance becomes almost like an addiction. That people want to not only have the information, but they also want to have an authority like yourself say, you don't need to worry about that. The trouble with that, and this is one of the things we'll talk about in therapy with people, is how long does that last? And so one of the things I might ask someone who's seeking a lot of reassurance is, if for example, I were to give you an hour's worth of reassurance instead of just 10 seconds, how long will it last? It's pretty much the same, just a few minutes, because my need will come back. So one of the things that we know is that reassurance is a self-maintaining thing. It's checking, and it actually has the effect of undermining people's certainty in the thing that they're seeking reassurance about.
And that's the thing that is almost the maintaining factor?
It is a maintaining factor. It is one of the most important maintaining factors. Now, here's the thing, because you think, we just have to stop people giving reassurance. That doesn't work. No, absolutely doesn't work.
No.
Now, again, it's quite similar to, for example, let's go back to OCD. Again, just because I think comparison is an important, compelling one. If someone washes their hands a lot, then you could turn the water off in their room so that they can't wash their hands anymore. What will happen? Well, they'll go somewhere else to wash their hands. If you turn the reassurance off, right, then if you stop the doctor or your loved ones or whatever giving reassurance, then that's not going to work, because you'll find it in other ways, and you'll no longer say, oh, do you think that's anything? Say, oh, I'm not worried about this. Look, I actually looked. There you go. So, and then your non-reaction becomes so, and so on. So, what you have to do is the same as you have to do in OCD. You have to get people to choose not to seek reassurance. So, actually, it's the seeking of reassurance, and what we do as therapists is support people in that process. Now, there's a very important difference here between these two things that people do: seeking reassurance and seeking support. So let me differentiate those two for you. Let's suppose you have a really bad day and you go home to your husband and you say to him, oh, it's a really bad day. And he says to you, don't worry, Shania, tomorrow's another day. It'll be better tomorrow. How do you feel? Do you feel like that's really helped, or do you feel like you want to slap him? Don't answer the question.
I was going to.
In fact, what you you don't want reassurance. So reassurance, on the face of it, looks okay, but it's kind of empty, isn't it? Oh, tomorrow's another day. You'll be fine. That's really hopeless. Oh, don't worry. That's not cancer or whatever. So what you want is support. And support might mean he says, oh, come and sit down. Tell me about it. Oh, he said that. That's really stupid. That person said that. And you want the person just to listen to you, to accept you and provide support. So what we're doing in the treatment of health anxiety is we're helping people identify the possibility that their problems are being compounded by the worries they have, that the problem they've got is an anxious one. And then we help them then shift their attention from seeking reassurance to seeking support. So you might say, if you're a patient, you might say to your wife, my health anxiety is really bad at the moment. Can we do something? So let's go for a walk or something like that. And people say, yeah, I'm really pleased with how well you're dealing with this health anxiety. I realise it's very difficult for you, but let's see if we can do something that's more interesting than talking about health and so on. So we shift people over so that people are choosing to do things in a different way, and they're shifting away from reassurance seeking to support seeking. And support seeking, in the end, throughout the whole of the field that we work in, is one of the most valuable things that the loved ones of people with any problem can offer.
And we are not very good at it, are we, at asking for help and support? And I suppose it's a fine balance, because we are taught, and as it should be, to identify symptoms and signs early. On the radio you hear about stroke, you hear about heart disease, etc. So at some level, some health anxiety is protective.
Well, there's also something about the way in which when people are very worried, they might do things in a way which seems to be helpful, that it's thought to be helpful. So let's take something like breast cancer, right? Breast self-examination is a useful thing to do, but not every 20 minutes.
No.
And if you do it every 20 minutes, then there's a whole different set of problems that are occurring. So it is appropriate that people are concerned about their health, but not to the point where it becomes counterproductive. So what happens in health anxiety is the things that people do to help themselves become the problem. So the solution becomes the problem. And that can be going to see their doctor or self-examination and so on. Now, the other thing to remember here is that health anxiety, one of the main risk factors for being worried about your health is actually having a problem with your health. And so, and that's helpful for people to know when I'm working with health anxiety, that I also work with people who have heart disease and who are anxious about that.
Yeah.
And under those circumstances, so you have heart disease and you get angina and so on. And so what's happening there is the anxiety is being amplified. So, you know, something in your chest and then you think, oh my God, I'm having a heart attack right now. And so you start to panic, you get super anxious, and it's helping people balance out the need to be prudent and to be helpful against the worry itself. So in things like heart disease, one of the things we know is that people need to be able to exercise as part of rehabilitation. But if you're very afraid, then you choose not to exercise and you'll become more and more unfit, which of course puts you at greater risk for heart disease and so on. So it's balancing these things out. So health anxiety is not just about people who are healthy, but also it works in people who in people who actually have serious physical illness.
Yeah.
We recently completed a study in multiple sclerosis where we looked at the interaction between multiple sclerosis and health anxiety. And what we found is that people who have high health anxiety alongside the multiple sclerosis perceive themselves as more disabled and have poorer quality of life. If you're able to help them reduce their anxiety, you can't eliminate it because it's an anxiety-provoking thing, but reduce it to the levels of other people, then quality of life improves and the perception of disability decreases.
And that would be true for any chronic or relapsing illness, right? Be it cancer. We've been involved. I've been involved in a study of cancer where individuals become extremely anxious in between episodes. That is, if there are further episodes, fear of cancer recurrence. Absolutely, and about 80%, probably 60 to 80% at least, live in fear. And there's that. Then you can see how the health anxiety might start to escalate.
The other thing about this is it also applies within mental health. So people, for example, who've had an episode of psychosis have a fear of illness recurrence with that as well.
Depression.
It's understandable, well. but it's a matter of balancing that out with being able to live a good quality of life.
Yes.
And it's balancing those two things. So it's tricky, and it needs often when people have an actual illness, it needs coordination between the psychological professional and the physical professionals, and that's one of the things that liaison psychiatry and behavioural medicine does very well. And I think there's lots of, I mean, it's an expanding field.
It is.
And clearly there's a massive need for this because in the end it's not just about how long you live, but it's also about the quality of your life when you're alive.
I completely agree. What 3 tips would you give to people who are a little bit at this end, not quite debilitated by the health anxiety, but recognize that it is slightly more than it should be and are quite keen to take control over it and manage their lives despite the anxiety?
Okay, well, the first thing is to be aware of what we call selective attention.
What is that then?
Well, it's looking for trouble. It's looking for trouble. So, and I mentioned the example of, you know, if you self-examine, for example, repeatedly, you're looking for trouble, then you're going to find lumps, and after a couple of days of repeated self-examination, you're going to have painful lumps as well. So there's being aware of that, being aware of the extent to which you're actually excluding other areas of your life, so that you're not paying enough attention to your loved ones around you and so on. Get that balance right. The second thing would be about reassurance seeking. So if you find that you're seeking reassurance a great deal, that you're going to your GP more frequently or whatever, then it's a really good idea to actually put some gaps in there, you know, and think, well, you know, if there's anything wrong here, do I need to go and see my GP right now, or can it wait a couple of weeks? And what I could then do is I could keep a record of what's happening. So every day say, well, how bad was this pain in my chest or whatever.
So almost have a diary.
Yeah, have a diary so you can track it. And also notice the extent to which stress might actually impact on it. So one of the things we know is that if you're worried about your health and then something stressful happens in your life, that tends to make it worse. Or it can have the exact opposite effect, that because something else intervenes, you become completely distracted from it and
you forget.
But then recognise what these patterns might mean.
Yes.
3 things you said.
When you talk about, yes, well, I'm going to go back to number 2, the journaling
Yeah.
side of things, or keeping a diary. Again, we have to be very clear about how long we diarize for, right?
Oh,
we don't want to be diarizing
just a few
all
days.
the time.
And one of the things you want to be keeping a diary in is how anxious you are about your health.
Yes.
So to track that, not just how you feel in terms of your physical sensations, but how anxious you are about your health. I suppose that takes us to the third thing, which would be that to recognise that anxiety is a force in your life. And it's a force for good, but it can also be a force that interferes with your life. And understanding that. Arming yourself with a bit of information. There are several very good self-help books, websites and so on about health anxiety. In America, it's now called illness anxiety disorder. It used to be called hypochondria.
Yes, it used to be.
But that's ancient history now.
Yeah.
And so on. So arming yourself with a little bit of information about how health anxiety can make these things worse.
Wonderful. Thank you so much, Paul. That was really interesting, really helpful. Thank you so much for being on this video. If you enjoyed today's video, please subscribe to the channel, like it, share it, tell it to all the people you know. Thank you for watching.
Thank you.
Thank you.